Today's broadcast is brought to you by HIC Agency Incorporated, located at 7070 West 107th Street in Overland Park, Kansas. You can contact us at 913-375-2122. Again, that's 913-375-2122. You can also visit our website at HICINSUR. That's hickinsure.com. Again, that's HICINSUR.com. Hello, and thank you for joining us today on the HIC podcast. This is Matthew Hickman in studio with David Hickman, the president of the HIC agency. We'd like to thank you for being here with us. You can learn more about us on our website. That's HICINSUR.com. This is the first of many podcasts we're going to be doing. This is the first of our series on why HIC agency. There's plenty of insurance agencies out there. There's plenty of brokers, plenty of fully insured options to go with. Isn't that right, David?
There's a lot. There's a world of plans out there, and picking the winners and the losers sometimes is a challenge.
Absolutely. Tons of options to choose from. So let's start this off. Again, David Hickman here with me in the studio. And David, what is it that sets us apart? HIC agency. What is the real difference? If you had to put your finger on something right off the top, what would that be?
Well, it's real simple, Matt. We align our goals with our clients right out of the get-go. Before we talk about any plan designs, any plans at all, we sit down and talk about, as an employer, what are your goals? Not only financially, is it to stabilize the cost of the premiums of your plan? Or is it to stabilize the benefits? Or perhaps your plan has already eroded in the benefits area, meaning your deductibles are so high and copays are so high that it's really not even a benefit anymore. So again, the first step here is aligning our goals with yours. And then secondarily, actually putting a value on that. And what I mean by a value is we will put a contractual guarantee that if we cannot meet those goals, we will forfeit part of our consulting compensation back to you. That's how you know that we are aligned with your goals, because we're willing to put our compensation at risk. I don't know anybody else in the marketplace willing to do that.
I haven't heard of that myself. I've never heard of that. But so you just touched on a lot of things there, and I want to go back. So there's a few things. So first of all, aligning our goals with theirs. In plan design, that's, we were having this discussion with a good associate of ours, Kerry Hall, not too long ago, and he brought up a good point, and he said, if they have any goals, right? I mean, healthcare, in my mind, is something. The goal is don't break the bank. We need to keep these costs. We need to fight these. We need to combat the high cost. It's and the goal really is such. So to think, wait, what is our goal? What would we like to offer our employers? Better benefits? Would we like to have lower copays, lower deductibles? Talk about how we can do that a little bit.
Well, that's a good point. First of all, there's a big misconception. Many of our clients are hospitals and hospital systems, and we know from working with those hospitals and hospital systems that giving employees a higher deductible and a higher copay does not make them a better consumer. It does not make them a healthier person. In fact, what we've seen is that in many cases, because of those high deductibles and high out-of-pocket costs, employees are avoiding care. They may be even avoiding taking prescriptions that are maintenance medications that they should be taking. So one of the things that the goals that we have is, how do we make sure that we're meeting the needs of the employees that you are insuring?
Exactly. So making sure that, like you said, we've been seeing the trend is kind of to combat the high cost. The trend is to kind of lower benefits, right? That's one of the main steps, and that's one of the things that brokers will say when they come in. First, you want to lower your out-of-pocket costs. Well, we need to start cutting these benefits back and transferring some of that risk over to the employee, right? But But with that, you're going to have a lot less utilization of the healthcare plan, of those, those every so often events, right? Your preventative maintenance type of visits. But outside of that, you're really going to be scarce to use your insurance in fear of hitting that $7,000 max out of pocket, right?
Well, and it really contradicts what you're trying to accomplish as an employer in most cases. You're trying to give your employees a benefit. By definition, that's an advantage for healthcare. And when you take the deductibles and the out-of-pocket cost and you inflate those, or you pass that along, it may lower your premium, but it just shifts those dollars to the backs of the employees, and it's a huge disadvantage when it comes time to hire a new quality employee when you're trying to compete with an employer down the road that has a better healthcare plan, a better mousetrap, if you will.
Yes, it does. So just to recap on that, we come in as HIC agency, we come in and we kind of get a feel for what your goals are. And if you don't have any goals, then we sit there and we kind of break down the options, the things that we can control, the things that we can change. And that's something that's very important and that's seldom talked about now. So moving on, the other part about aligning our goals with yours is the compensation portion of that, right?
Yeah, absolutely. Part of our strategy is to make sure that we're aligned with you as an employer. And to that point, we'll put part of our compensation, our consulting compensation, at risk. We'll put a third of that compensation at risk if we don't meet those benchmarks that we set up in your objectives in your goal session.
Yeah. So that's huge. It's saying that, hey, if when we write this plan, if we don't hit this benchmark that we're saying we can save you money, then we're willing to forfeit a third of our compensation or a percentage of our compensation. That's huge. That is showing you, the client, that our goals are not that of a fully insured, because structurally or fundamentally, the way fully insured insurance is set up, and I'll put a link to a piece of material we have down in the subscription to the video below, so that anybody that wants to look at this can pull up our marketing material and see exactly how it is that fully insured or traditional insurance is structured to actually have goals that are malaligned with that of the actual client. Isn't that right?
Yeah, that would be correct. And the advantage is for them to actually have inflated cost and an ever-increasing revenue stream. And they're typically looking at a 15% profit margin. And let's face it, would you rather have 15% of $1 million or 15% of $2 million?
Right.
It's very simple to see where their goals and their objectives are with their health plans that they write. But I think one thing even beyond, once we've set those goals and strategies, you'll see where we actually go to work and analyze your claims data, see where your highest risk factors are. And what I mean by highest risk factors are what's driving your claims, that's driving the prices behind your plan. So, for example, let's say that you have 2 or 3 people on a high-cost medication, might be a specialty med like Humira. Humira, that script's written every day. If you look back 6 years ago, that drug was in the $2,000, $2,500 price range per month. Today, it's $5,400 for that same script. That Humira script, we can source for your employees for a zero copay, and we can get that for about 25% of the cost you see in the retail pharmacies today.
Absolutely. So that kind of moved along into our risk management strategy right there. So again, why HIC agency? We align our goals with yours. We're going to forfeit a percentage of our compensation if we don't hit agreed upon savings benchmarks, okay? And then beyond that, how are we so confident to risk some of our compensation? It's because this isn't luck. This isn't something that we've gotten a couple of good groups and had a couple of good years. This is a proven strategy. We have programs in place. We have a strategy, and what our strategy is risk management, right? So we identify, we're going to then mitigate, reduce, or eliminate. Then from there, we're going to control, and then from there, we're going to monitor, right?
Yeah, that's exactly right. So let's take a look at the fastest growing segment of any healthcare plan, and that is diabetes.
Yeah.
That disease is the number one fastest growing disease in the nation today. And diabetes affects every single organ in your body. One of the things that we saw over the years was that testing supplies for diabetes are quite expensive. It may run $100, $125, $150 a month for that diabetic to test to doctor's orders. What I'm talking about is the test strips, the lancets, the meters. And knowing that, and knowing that some employees may not test to the doctor's specifications, they may say, you know what, if I test once a day instead of 3 times a day, that $150 I paid for the supplies is going to last 3 months, not 1 month. So to save a few dollars, they may not be testing to the doctor's adherence. And because of that, what happens if they end up in the emergency room because of low or high blood sugar? That, on average across the nation, is running about $11,000 for that episode.
Yep.
What we found is it's much more affordable for the plan to pay for those healthcare, those supplies for that diabetic, keep them out of the emergency room, keep them at work and active. Everybody wins there. And furthermore, we're just really happy to announce that we're getting insulin. We're able to source insulins now at a zero copay or a lower copay for employees because of a way that we at the HIC agency are able to source those medications. So again, now we're making sure not only that they're testing to the requirement, but they also have the insulin that they need when they need it at the lowest cost possible.
So this is huge. This is a big announcement. This is huge. I can't say that enough. Everybody out there has employees that are type 2 diabetics. Centers for Disease Control in January of 2018 released a study that said 100 million Americans are diabetic or pre-diabetic. 80% of those who are pre-diabetic don't know they're pre-diabetic. So we have a lot of diabetes in this country, and I think we all know that, lifestyle and ease and affordability of McDonald's and so on and so forth. I don't think it's any surprise. But I think that having a solution, having a plan in place is what would you say? I'd say
it's the difference between your premiums being level or ever increasing. You have to have a strategy in place, and it has to be in place prior to that episode happening. So I'm not talking about being reactive. We're talking about being proactive on the front end and making sure that we can see what's coming down the road and that we have a program in place to mitigate, eliminate, or reduce that risk as much as possible.
Right. And so being proactive, we're going to eliminate or reduce the copay to that employee. We're going to ease their life by shipping all of their testing supplies right to their doorstep. And then we're going to mitigate and we're going to monitor a huge risk to the plan, right? I mean, because that's a huge expenditure. And this is a perfect example of how we identify, then we control, and then we monitor, right?
Correct. I just saw today that one of our groups that we've had for a number of years has a new employee that's coming on. That new employee is on an insulin that is running about $18,000 a quarter. Okay, and we will be on top of that. We will have our services looking at shipping that insulin to the employee at a zero copay. And then additionally to the employer, instead of running about $18,000, will be less than $4,000 for that same quarter where they were paying $18,000 before. So, and again, that employee will get free testing supplies shipped to their doorstep.
Yep. Free testing supplies, definitely a reduced or a $0 copay on that insulin than from what they were probably hitting their RX deductible on that before. They're going to have a reduced cost now, and then the city's going to have a reduced cost on that as well.
Right. I think another really good example of how we take a look at risk and look at a plan and we just have a different perspective than any other agency in the industry. So, for example, our wellness program. Okay, the wellness program, when we're talking to HR people, one of the things that we found out is that about 67% of those HR administrators have said that stress stress is one of the biggest things that they have concerns about.
Yeah.
They talk to employees about it all the time. And one of the bigger types of stress that we're seeing was financial stress.
It's huge.
Well, one of our cities that we insure recently had an employee that was going through a tough time financially. They were actually going through a foreclosure. One of the individuals in that household suffered a heart attack. That claim was over $100,000. What we take a look at is, how could we have avoided that claim? How could we help? How can this healthcare plan help reduce or eliminate the chance of that person having a heart attack, that stress? So one of the things that we are now doing is we're implementing a program that's called Smart Dollar. And it may sound familiar because it is a Dave Ramsey program. Dave Ramsey is the back room on that program. And then we have a staff member that will go out, sit down with the employees and their spouses and talk to them about, how do we handle our finances and how do we budget? How do we stop living paycheck to paycheck? And by doing that, we're not only we're reducing the stress at the core. Instead of, in a typical healthcare plan, if an employee is having some stress, what happens? They go to the doctor. The doctor sees the stress, and they're probably going to give some medications. They might give something for anxiety and all of those things. They haven't solved the problem. They have masked the problem. And what we try and do is get to the core issue, solve the core issue, and avoid them taking drugs and never having anything solved.
Yeah, I heard a great analogy one time. You go, the way the medical industry works now, you go into the doctor because you have a rock in your shoe, and you explain to him that you're having foot pain, and then you leave the doctor's office with a prescription for a pain medication and with a diagnosis for foot pain, right? I mean, instead of taking the rock out, or instead of diagnosing and figuring out what is the cause of this stress, right? Is it financial? Because if it's financial, I've got the best resource for you here. I've got the Dave Ramsey Smart Dollar. It's Financial Peace University, basically, but broken down and put into a phone app. So now you can use this on your own time. You don't use apps. You don't like your smartphone. That's okay. Log in on your computer. Pull it up on your desktop. This is custom. You use this when you're ready to. Log in at midnight once you put the kids to sleep, once everything's done. Get in there and then start working on it. Create your budget. Make your budget, sync it with the Every Dollar app to your bank account so that when you spend something, you're responsible for it. Right then, it's going to ding your phone, and you're going to have to take that McDonald's transaction that you just made, and you're going to have to categorize that into one of your slots that you budgeted money for that expenditure, right? So this is a huge tool. This is something that, one of the things that I think is that, when I was going through the program, it was just astonishing to me to listen to all this stuff because I was never really educated on compound interest, right? And I was never educated on a lot of these things. And I believe that a lot of our clients, and I believe that a lot of employees out there could benefit from knowing all of this information. And I know for a fact that so many people could benefit from having a solid, steady budget that as soon as you do it, one of the things Dave Ramsey and one of the things that all of the other associates on there, I forget the other guy, Chris Hogan and Natalie Cruz are the other people that are with Dave Ramsey on the Smart Dollar program. They're all genius. But one of the things they say is when you do this budget, an Every Dollar budget, you immediately feel like you gave yourself a raise. And that's something that I can definitely stand up for. It's something that you do your budget, and then all of a sudden you have money, right? You might not be saving it right this second. You might be paying off all your old debt, but you feel comfortable. You've got your backup $1,000. You're going through it. So, that is a huge thing. And stress, especially financial stress here in 2019 is all too common in every walk of life. So
well, and we talked to our pharmacy benefit management company, and I asked him to pull a report that shows the drugs and the different parts of the pharmacy benefit program that we might be able to track stress related to. And quite honestly, he was kind of pulling his hair out saying, David, pretty much every single thing. Stress impacts everything from heart disease to, maybe someone having a substance abuse. It can be very, so it's very encompassing. But I think that's what I like most about our healthcare plans is the perspective that we have is, how can we change the outcome? How can we change the root cause of the problem and eliminate that or reduce that? And that's been fun because I don't know of anybody else that's using the Dave Ramsey program as a wellness tool inside of the healthcare plan. And as I talk to HR folks, many of them would love to offer a Dave Ramsey type course, but they don't know where to get the money for the budget. It's included in our healthcare plan at no cost.
That's right. And, one of the great things about it is that, like you said, we address the underlying factors, right? And that's what's actually going to make the change in your bottom line. But for me as a wellness coordinator, that it's so fun because what that ends up being, us addressing those underlying factors, what we end up doing in the long run is improving the lives of everyday employees, because that's what's going to make us healthier. That's what's going to make us, do better on our healthcare, better consumers of healthcare, is if we're healthier, if we're happier, if we're mentally healthier, more stable. So, on the surface, we look at programs that are going to benefit the employers and help to eliminate, mitigate, and reduce the costs of healthcare. But what we end up doing is benefiting the lives of all those employees by giving them these tools, by giving them the Dave Ramsey, by giving them the wellness apps, the walks, the step tracker, the daily education, the smoking cessation. All these programs are things that benefit their lives, right?
Correct. Yeah, that's exactly right. And one of the things we kind of skipped over a little bit, and it is something that impacts quite a few lives in our employer block, and that is divorce. When you look at what financial stress does to a family and how many divorces have actually kind of been spawned by that financial stress. And then you look at that employee and you say, they may be showing up to work, but how present are they at the job? How effective are they at the job while they're going through that stress? And the answer to that question is that they're not there at all. They're really not there. They're sitting at the chair, but they're not engaged in what you need them to be engaged in. So again, a very comprehensive healthcare plan that takes a look at the root causes of things and helps your employees to be healthier is a win in every single faucet.
I couldn't agree more. And, to that effect, that the financial turmoil is the number one cause of divorce in the United States. So, I'm not sitting here saying we can avoid divorce altogether, but I'm saying, what if you could put that tool in the hands of your employee? What if that's something that you could do for no cost to that employee? How big is that? How big would it be if you had a diabetic employee and you could then eliminate all of their out-of-pocket costs? You could ship them their insulin and you could ship them all of their testing supplies.
Yeah, it's kind of interesting when you talk to HR people that are really looking out for the best interest of their employees, and you frequently hear them coaching employees on finance to a degree, and trying to help them understand that often dipping into the 401k might not be the best option. Actually managing your finances like we're talking about is better. And this should be a very first step in employment, I would think, would be to have them go through a program like this so that their whole career is better financially, at least.
100%. 100%. Well, I think that's a pretty good first episode. What do you think? Did you have anything else?
No, I don't think so. I think we'll dice this up and put it out there.
Yeah, I think we've got, some more things to dive deeper in next time. We can continue to talk about the diabetic supplies program that we have. We kind of skipped over a little bit, but didn't get into some of our prescription programs. We'll have plenty to talk about that. Again, our wellness program, that's probably one of the most well-rounded wellness programs out there. And again, all of those wellness things that we were talking about are included in the plan, in your total maximum expected cost, right? When we give you that quote.
Yeah, and these podcasts are going to be organized on our website. And you'll be able to go to those podcasts when you want to, 24/7. Download that podcast that you're interested in. And if you don't see something that you have a concern about, certainly either reach out to us through the website or give us a call on the 800 number.
Yeah, absolutely. All of that information will be below in the link. Please like and subscribe. Again, our website is hincinsur.com. Our phone number is 866-257-5733. I'm Matthew Hickman here with David Hickman from the HIC studio. This is the HIC podcast. Thank you, everybody, and you guys have a good night.